With the new policy now in effect for Medicaid and MIP patients that limits coverage to emergencies only at the new hospital, how will this affect the more than 50,000 subscribers? PNC's Janella Carrera sat down with Public Health Director Jim Gillen to find out more.
They gave less than 24 hours notice. Medicaid and MIP patients will only be covered for emergency services at the Guam Regional Medical City effective today. Over 50,000 subscribers will be affected. Public Health Director James Gillen says the decision was difficult but necessary.
If we assume that all things are equal, okay, if you look at two rings and they're exactly the same, okay, one is $1,100 and one is $5,000. What would you do? You'd pay the 11. Yeah. So we've kind of made a business decision.
On November 16th, or just about 2 weeks ago, Gillen says that's when they first received notice from GRMC that the Medicare reimbursement rate CMS had approved for them was $5,075 a day, a stark contrast to the rate the Guam Memorial Hospital receives, which is about $1,100 per day.
We really just went, we couldn't. It just didn't register. How, saying how could it be that high?
Because the Medicaid and MIP reimbursement rate essentially mirrors Medicare rates, this means public health will have to increase that per diem rate to $5,075 as well.
Coincidentally, a couple of days after they told us that they had this $5,075 rate, we got a stack of bills that came up to $22,906,000 for Medicaid, and that's just our estimated from January to September. So we still have October and November. The billing from MIP was $12,754,000. If the payment was based just upon the interim rate of $5,075, we would be paying them on the Medicaid side, $20,455,000, and almost $12 million from MIP.
Public Health conducted a cost analysis for fiscal year 2017 that shows GRMC's new per diem rate of $5,075 will cost them $23 million. If the rate were to be based on GMH's $1,100 per diem, it would only cost about $10 million. Gillen says with CMS's recommendation and approval, Public Health made the very tough decision of only covering emergencies at GRMC. So what exactly qualifies as an emergency?
If you think you have an emergency, you go to the nearest facility, and we'll have to work that out with them.
Who makes the determination though as emergency? Does the hospital do that?
Well, we have our own folks who are, who are unlicensed physicians, but we can always argue that. Whether this is and it's generally life-threatening, fractures, severe bleeding, those kind of things.
But things for like urgent care?
Urgent care, no.
Gillen also says that they are looking at ways to amend the Guam state plan, which would only cover the lowest rate of the two hospitals. Until that amendment is made, or until any other negotiations can be made, the new policy will remain in effect. Janella Carrera, PNC News.
Late this afternoon, Gillen contacted PNC to clarify that per CMS, Public Health must give 30 days notice before they can amend their contract with GRMC. This means the effective date of the new policy will not be December 1st, but according to Gillen, sometime in early January.